Empire Eye physicians have been devoted to the vision and eye health of patients throughout the Inland Northwest for over 60 years. Our mission is to provide excellence in eye care through our experience, professionalism, and caring manner. With nearly 20 years' experience, our highly trained staff and outstanding physicians provide the highest quality medical and surgical eye care in a comfortable, stress-free environment.
Our goal at Empire Eye Physicians is to assist you in the information process so that you are better positioned to make a decision concerning cataract surgery from an educated and informed standpoint. This information is designed to give you a better understanding of cataract eye surgery and all of the different intraocular lenses that are available today, as well as the latest technology, laser-assisted cataract surgery. You and your loved ones will then be properly informed to make the correct decision for you.
As light enters the eye, it passes through the cornea, which bends and refracts the light rays as they pass through the pupil. The light waves then pass through the lens and focus the light onto the retina. A cataract is a clouding of the natural lens inside your eye. The lens can become so cloudy that it keeps light and images from reaching the retina. A cataract can also be the reason for blurred images, brightness and color to become dull, or increased glare and sensitivity to bright lights, or difficulty driving at night with oncoming traffic, or in brightly lit stores or rooms. Cataracts are a natural part of the aging process. However, injury to the eye, certain diseases, or exposures to certain medications and radiation can lead to premature cataract development. Cataracts are the leading cause of blurred vision and blindness in the world. Cataract surgery is among the safest and most common procedures performed in today's hospitals and ambulatory surgery centers. Surgery is the only option for removing a cataract. In this procedure, the cataract or cloudy lens is removed from the eye and replaced by an artificial intraocular lens. In the past, people waited until cataracts were ripe. This is no longer true with modern surgical technology. Cataract surgery can be performed at any age and at any level of cataract formation, even for patients who wish to eliminate their need for glasses in the way of having cataract surgery. Empire Eye surgeons perform all of their cataract surgeries under topical eye drops and monitored anesthesia, so no needle or shot around the eye is needed. This eliminates several risks found in traditional cataract surgery performed in other clinics where a needle is used. Our surgery is performed by making 2 small incisions in the cornea using a diamond blade. A small instrument is then used to make a circular opening in the capsule or membrane that surrounds the cataract. This allows access to the cataract with a phacoemulsification handpiece. This device uses ultrasonic power to break up the cataract and remove it from the eye through these very small incisions. Usually no stitches are needed. Here at Empire Eye Physicians, we are the first in the Inland Northwest to offer patients laser-assisted cataract surgery, in which the corneal incisions are performed with a laser in an exact and precise fashion. The capsular opening is also created with the laser to make a perfectly centered 5mm circle, and then the laser softens and fragments the cataract. The surgeon is able to remove the cataract with greater ease, and the more gentle laser surgery creates a quicker recovery for the patient. The laser is also used to make small, precise arcuate incisions to correct for corneal astigmatism. Once the cataract has been removed, an intraocular lens is then inserted into the posterior chamber bag, increasing the likelihood of having perfect centration to allow a clear image to be focused on the retina. For over 50 years, doctors have treated cataracts and inserted artificial lenses into the eye to restore sight. Traditional lenses only have one focusing point and can only be focused at either distance or near. Tremendous advancements have occurred in intraocular lens technology. Lifestyle lenses. Multifocal. These new lenses have allowed patients to have enhanced lifestyle vision, where the lens focuses at distance and near for computer and reading vision. Toric. Astigmatism, which is a curvature of the cornea that is shaped like a football rather than a basketball, can also be corrected with toric lenses. These lenses have 2 focal planes to allow correction of the astigmatism that can sharpen the vision for distance without the need for glasses. A patient that has a toric lens may not need distance glasses, but will likely need reading glasses. Some toric lenses also have accommodative, or near-reading vision, technology. Every effort will be made to achieve your goals. However, some patients may still require glasses or contacts for correction to achieve all of their visual needs. Regardless of the lens choice a patient chooses to make, the risks and complications of cataract surgery and lens implantations are the same. Although technology has made great strides in advancements in intraocular lenses, you must remember that the natural lens in your eye has distinct advantages over the artificial lenses. However, when you can no longer function adequately due to the poor sight produced by the cataract operation is a great opportunity to improve your vision. Based on your visual needs and medical considerations, you and your doctor are the only ones that can determine if you should have a cataract operation. Although the cataract procedure is quick and allows for relatively fast healing, it is a surgical procedure that does entail some risk. When removing a cataract and implanting the intraocular lens, complications that could occur include loss of corneal clarity, retained pieces of a cataract in the eye and need for further surgery, infections, uncomfortable or painful eye, hemorrhaging or bleeding, droopy eyelid, glaucoma, uveitis, iris trauma, abnormal pupil size, increased night glare and halos, double or ghost images, decentration or dislocation of the intraocular lens, retinal detachment, and loss of vision or the eye. These complications could develop several weeks, months, or even years later, regardless of the type of intraocular lens used. On most patients following cataract surgery, a posterior capsular opacity or secondary cataract will form. This may take months or years to occur and has symptoms similar to the initial cataract, such as constant blur, haze, glare, or dimming of the vision. The filmy membrane is easily removed with a simple laser procedure. Potential side effects of lifestyle intraocular lenses, such as multifocal lenses, are an increase in glare and halos at night, although most of the time these fade as the brain and eye adapts to the advanced lens technology. A toric lens may need to be rotated to place it back on axis if it shifts within the first few weeks of surgery. Laser cataract surgery. The risks associated with laser-assisted advanced cataract surgery include increasing the time needed to perform the surgery. Other complications include, but are not limited to, decentration of the cornea or capsulotomy incisions, incomplete or interrupted capsulotomy, anterior capsular tear, and posterior capsular tear. Fortunately, these complications occur very infrequently, and cataract surgery has become a very safe procedure. In rare instances, lens power measurements may significantly vary, resulting in the need for corrective lenses or surgical replacement of the intraocular lens. Patients who are highly nearsighted or farsighted, or who have had LASIK, PRK, or RK, have a greater risk of unplanned visual outcomes. Additional testing and measurements are performed to improve the accuracy on these patients. The results of surgery cannot be guaranteed, and additional treatment or surgery may be necessary. Although it is impossible to inform the patient of every possible complication that may occur, please ensure that you have had all of your questions answered, alternative to surgeries offered, and you have understood the consent form before undergoing any surgical procedure. The eye care field and your eye health is constantly evolving with new needs and challenges arriving at different times.
I'm Dr. Mark Contos. Our goal here at Empire Eye Physicians is to provide you with the most advanced technology available in order to allow you to live your life with the best vision possible. For many, the decision to have cataract surgery is the most important health decision that they can make. We greatly value the trust that you have placed in Empire Eye Physicians to provide you with the best possible surgical experience. We will do everything in our power to make sure that your decision to go forward with cataract surgery is the life-changing event that so many people before you have experienced.
Immediately, you notice everything was so bright. You know, the sky was so blue and the colors were so vivid. I had no idea I was missing out.
I couldn't believe how bright everything was. Blue was the thing that stood out.
When I went home and turned on lights, it was like they were so much brighter, and now I can see street signs.
I didn't really have any reservations, especially after meeting the doctor and all the gals.
The staff here was very professional, very courteous.
Oh, I had a good experience. I don't have any trouble getting along with anybody here either.
Absolutely, I would recommend Empire Eye.